Hello, my name is Kimberly Stanley. I'm from Winston-Salem State University, and today we're going to be discussing cardiac troponin 5th generation. So not a lot is known about cardiac troponin 5th generation because it is a newer analyte that's being used in hospitals to treat and early diagnose patients with cardiac events or AMIs. So, as we know, we hear every day on the news, or we know from family members or something like that, that the most common reason patients go to the emergency department is for chest pain. Well, the lab plays such a crucial role when those patients show up in the emergency department with chest pain. Getting an EKG done, but the lab work is very important as well. That early detection and proper diagnosis is key to great patient outcomes. Typically across the board, facilities have protocols and order sets, and there are common tests that are used to monitor for any damage to the heart muscle or to diagnose whether the patient is actually having a cardiac event. One of those tests that's typically used is troponin I or troponin T, depending on the assay that's being used at the facility we're talking about. It is one of the most commonly ordered tests. There are advancements to technology, and one of those advancements is the possibility that there's a different value between men and women. The comparison between genders could be a missing link in the diagnostic and treatment areas for the medical model that we're talking about, because of women, as we know, typically when they show up don't have the typical symptoms that men do. One of the other interesting pieces of this research has been that troponin levels currently are reported out as in less than for negative, less than 0.01, whereas with the new troponin assay, it's given in whole numbers. So that is another change. But evaluating and implementing this high sensitivity troponin assay could be very beneficial for evaluating the female population for cardiac events and earlier diagnosis of those AMIs. Because as we said earlier, women typically present differently than men to the emergency department. They typically have a lower rate of MIs than men. Women typically show up, as we've heard on the news or we hear from our doctors. Women can sometimes have arm pain, shoulder pain, back pain, and that be indicative that they're having an acute cardiac syndrome or an MI. Whereas men across the board can typically have, I broke out in a sweat, crushing pain on my chest, and felt like an elephant was sitting on me. That's how my brother felt when he was having his MI at the early age of 42. But yeah, so that's typically, so women present differently. So that goes along to say, do women get misdiagnosed or do they go underdiagnosed? So we talk about that troponin being the common test that's ordered and evaluated. Like I said, the emergency departments where most people go when they think they're having an MI. And those order sets and those group of tests will more than likely include a troponin test, whether it's troponin I, troponin T, or whether it's the cardiac troponin 5th generation test that we're discussing here today. Troponin I and T are proteins that are found in the cardiac muscle, which makes them a very useful and diagnostic tool for patients when you expect a cardiac event. Troponin assay testing has been available on most chemistry platforms for quite some time now. Back in the 90s, I think, is about when the troponin I's and troponin T's were first brought into the laboratory field as being a test that they were using. Of course, things change, and it's not very often that we get a new test to monitor. But the improvement of this troponin assay has led to identifying sex-specific and gender normal ranges in the healthy population of males and females. So what that means is we're all walking around, most healthy individuals are walking around with a troponin level, whereas before, if you had a positive troponin, it was indicative of an MI. This goes to the high sensitivity of this new assay. So the 99th percentile for females, in the population has been proven to be lower, which tells us that they have a lower rate. So those sex-specific gender ranges would be very beneficial for women if the ranges are lower, rather than having one cut point or one set of ranges that includes males and females. So that lower probability of MIs, typically showing up for cardiac events and maybe not having your typical chest pain, your typical symptoms. That could also be very indicative, and another reason why having a more sensitive assay would be very beneficial. And high sensitivity troponin has been used in other countries for quite some time, but it's not been until here recently that's been approved for use in the United States. So it's still a relatively new assay that's being evaluated. A little history about troponin. Troponin is a group of 3 proteins that can be found in the heart muscle. So therefore, it's very indicative and very specific of either looking back for previous damage maybe, or for diagnosing the EMIs that are occurring, at the time of presentation to the emergency department. So, like I said, we are going to be analyzing and performing this testing on the Cobas 6000. The Cobas 6000 is currently being used in lots of facilities. And then, of course, the standard way of testing for these, any type of test is the same. We will actually be running 2 levels of control, as we would normally do. Based on other studies that have been performed, when we do start our evaluations, they have shown that the Cobas 6000 does have sensitive assay. Some of the studies have shown that based on sex gender cut points, that women will actually have more highly positive results than they did previously with previously used troponin assays. In one large study that was done, they actually looked at patients coming to the ED and had a 0 and 3 hour cut point, which means you get a troponin when you enter, and then you get a troponin at a 3 hour. This will actually help the physicians be able to determine whether you need to be admitted, whether you're actually having a cardiac event, or whether you can be discharged home maybe to follow up. But of those, it did show that it led to an increase of MI diagnosis in women from 16 to 22%. On a much smaller scale, a study was performed at one of our affiliate hospitals. We actually feel like our 2 facilities are very large, and we have basically the same patient population. They did a study that tested 125 patients. Out of those 125 patients, they were ran congruently on the Cobas 6000 using 4th generation, and then used on the Cobas 6000 using the 5th generation high sensitivity troponin. And out of that study, the preliminary results showed that using a cut point for women of 14 actually showed that 15 of the patients, women, would have had a high sensitivity troponin compared to 4 using 4th generation. Now, granted, you have to take into consideration other things that could have been going on, and that has to be done by the physician at the bedside. Same thing for men, did show an increase, but not as much as it did for women in results going from potentially a negative to a positive result. But seeing the results and reading and doing a lot of research based on this cardiac troponin Gen 5, really think that diagnostically for patients, for me, as I get older, for my family, for my parents, that being able to get a more highly sensitive troponin assay is going to be more beneficial for our patients. As I alluded to a little bit earlier, the troponin Gen 5 is approved by the FDA for use on the Cobas 6000, which is our current instrumentation. We will follow all of our policies and procedures for evaluating a new test. That includes establishing control values, running 2 levels of controls each day of testing. Of course, you have to establish your mean, your SD, your CB. You have to look at the sensitivity. You have to look at your probability of all your statistics before you go for to validate a new test. We will also have our medical director to review all data. We will also look and make sure that we don't have outliers or that we don't have anything else that shows up once we start analyzing for this new cardiac troponin. But I think above all, one of the most important things that when we talk about initiating any test, whether it's a cardiac, whether it's any type of test, we have other tests that have sex-specific ranges. So why should we not look at having sex-specific ranges for troponin? If it's going to show value, it's going to have value added for female patients, for male patients, because we know that it is a highly sensitive assay. But having the best outcome for patients, having male and female sex cut points is a positive. Knowing that we can discover those points much lower, values can be much lower. Using high sensitive troponin testing will provide faster, more accurate results, and it will actually reflect what's going on with the patient. So I really feel like that analyzing the cardiac troponin Gen 5 is going to be very beneficial for patients, and I hope that you have found this very interesting. Thank you.